As a
sure.
pathologist, since we are dealing mostly with patient samples,
Right.
most of the time we get the patient samples rather than the patient coming to us. So in that case, it's always a challenge because just looking at the blood, I am supposed to know so many things.
Yeah.
So, and at the end of the day, if the patient does not give a proper history, and if some facts are hidden from us, or patient, if suppose you are supposed to give us blood sample in an empty stomach, or 12 hours fasting status, as some of the tests demand as like that. So if you don't do that, and just for saving yourself from the agony of coming back again the next morning after fasting, and you just have a cup of tea and give the blood sample, and I'm supposed to treat it as a fasting sample, the results can vary.
Yes.
The results will vary, and then the confusion arises, because this based upon this report itself, you'll be treated. So the honesty of the patient, the cooperation, all this is a big challenge for us pathologists, and most importantly, we don't get to see the patient most of the time. We get the blood sample, and from there we are supposed to make a diagnosis. And so every little thing is very important. So it's a big challenge that we face every day, and especially in case of biopsies, the clinical history of the patient and the detail, the mode of presentation, and the pre-operative diagnosis, the clinical diagnosis, everything matters. So it's a holistic concept to come to a conclusion. So it's always better for your own safety. You give the samples with the proper preparations which are asked for, and just cooperate with the laboratory persons, and tell them whatever history is needed.
Yes,
and trust your doctor. That's very important. Many a times people go just by the brand. Just the brand name is there, but you don't see who's reporting. Just a scan signature at times, but you don't meet the person who has reported, and who has taken your taken the pain to sign, or take the. So it's very important that you know your doctor.
Yes.
It's very important that you know your doctor. You can have a word. He or she should be accessible. At least I personally believe.
Yes.
He or she should be accessible to the patients, and at least whenever I'm signing a report, I should be able to quench your queries, at least, and vice versa also. So when the doctor wants to know some history or some facts that you have been going through, so at that point the patient is also responsible to cooperate and get back to the doctor. So that is very important, and of course, pathology has gone a lot of upgradation. We have very high-class instruments these days. It's an era of full automation.
Exactly.
So there, as a pathologist, I always make it a point that we do some quality control tests. We are using not only internal quality control, but also external. External third-party control is very important, which I do in my laboratory. Right. And so that, I do a peer review also. I take a third-party control from Biored, or there are other companies like, Randox and all. So, and then I do a external quality assurance program with, CMC Vellore is one place which is doing for all people in the country. So there are so many ways actually you can just judge your work. It's very important to know that because we cannot just blindly rely upon the machines.
Yes, ma'am. Yes, ma'am.
So that is what we do to maintain the control. To maintain the quality in a laboratory, and that's very important. And we do checks at every level to assure that the correct sample is being processed and the correct reports are dispatched.
Yes,
so there's a quality check at every level, right from the sample collection till the report delivery.